Our next speaker tonight is Rhonda Kromm. You know her at Lincoln Middle School. She's taught there a good number of years. She's been very active in the WSU Alumni Center. She's been president of the alumni group. She has put forth students, or her children, through WSU. The fifth one, as soon as she gets old enough, will probably go to WSU as well. So Rhonda Kromm is a very important person in our city. She's been so active, but there's something else that she wants to talk about tonight, and she is a breast cancer survivor. So Rhonda, it's all yours.
Good evening, everyone. In the United States, 12.5% of all women will be diagnosed with breast cancer at some point in their lifetime. That's approximately 1 out of 8 women. 1 out of 8 is a staggering number. That means in this room, 1 out of every 8 women sitting around you will be diagnosed or has been diagnosed with breast cancer in their lifetime. Think about the ways in which breast cancer has touched your life. Yourself, your wife, your sister, mother, aunt, cousin, a neighbor, a coworker, a friend. Chances are good that everyone in this room has been touched by breast cancer at some point during their lifetime. At the age of 38, while I was traveling to Europe, I felt what I thought was a swollen lymph node in my left armpit. After returning to Hawaii from that vacation, I went to see my doctor. She examined me and assured me that the lymph node was normal. She opted, however, to send me in for a baseline mammogram 2 years prior to the point in time when they normally do that procedure. She was right. I didn't have breast cancer on my left side, but they did find some spots on my right side. Radiologists opted to biopsy those spots. And then I got on a plane and I came here to Pullman because I had an Alumni Association board meeting and I wasn't one bit worried about having cancer. I was young and I was healthy and I was happy, and no one in my life had had breast cancer before. None of my family had had breast cancer before. So I knew I didn't have breast cancer. I honestly had no concerns whatsoever. I had gone through the procedure, but I wasn't worried about it. So I got on the plane and came to Pullman. When I got in San Francisco, I had a phone call, or I had a message from my husband to call home. I called him, and my husband, being a nurse, went straight into his medical lingo and told me that I had carcinoma of the right breast. I confirmed with him, because my head was spinning a bit, that that meant that I had breast cancer. And when he confirmed that that was true, I experienced truly a Twilight Zone kind of moment. I was in the middle of this airport, and there were hundreds of people, and I was standing in the middle of one of the largest areas of the airport, and all of it was spinning around me, and I stood there completely disconnected from anything that was happening. I made my way to a wall in the airport, leaned against the wall while my husband's still talking to me and I'm completely not hearing anything he's saying. Leaned against the wall, slumped to the floor, and all I can think of is that my 5-year-old daughter's never going to know who I am. I'm thinking she's not going to understand or remember our relationship. She'll never know how much I loved her. She won't even remember what I looked like without the aid of pictures. My mind went to me in a bandana on my head, holding her on my lap, because I'd just seen a picture of another woman who was dying of cancer with a bandana on her head, holding her daughter on her lap in a picture in a newspaper. I began thinking about the letters that I would need to write my daughter so that on the special occasions in her life, she'd be able to have a little bit of me there with her. Now, all of this is happening in just a matter of a few minutes in my head, while my husband's still saying, I have no clue what. And in my mind, my world's ending. And all I could think about is that my little girl was never going to know her mother. My husband started coming back to me a little bit in my head now. And he was telling me he had a surgical appointment or appointment with a surgeon for me in 5 days, and asked me to get on a plane and come back home. So I made the decision not to come back home at that time and to continue on here to Pullman, because I was obviously very upset and I was emotional, and I didn't see any point in going home and spending the next 5 days in that state around my 5-year-old daughter and having everyone upset. So I came here to Pullman, was surrounded by some very supportive friends and colleagues on my board, as well as a sister who drove here from Yakima to be with me. I spent about the next day and a half wondering what was going to happen to my 2 older children and that 5-year-old little girl and my husband when I was gone. And how far had the cancer gone? I knew nothing at that point. And then my "what the hell am I doing" thing kicked into my head, and I'm like, I'm not going to die of cancer. I need to figure out what I have to do to beat this thing. So I called my husband and asked him to give me my entire lab report. On the way home, I stopped in the bookstore at the San Francisco airport. I picked up a book on breast cancer. I read the entire book on the flight home. I got off the plane and I announced that I would be having a mastectomy. We met with my surgeon the next day, and once I convinced him that I was set on my treatment, we proceeded with surgery, a few months later reconstruction, a few years of drug therapy. Because of my early detection of cancer, I did not need chemotherapy, my early detection and my choice of treatment. I did not need chemotherapy or radiation. That was 13 years ago. Thank you. My fear of not being around my daughter is something that every woman who gets called back for a false positive, and that's 10% of all women who have mammograms, experiences until she finds out that it was a false positive. I wouldn't wish that kind of fear on anyone, ever. This is one of the reasons I'm so excited about this new diagnostic tool coming to Pullman. The incidence of false positives is greatly diminished with this tomosynthesis machine. I'm a very lucky woman to be here today. I'm a very lucky woman because of a fluke, good fortune, and luck. It was a fluke that I detected a lump in my left armpit, one that was swollen like lymph nodes often are, yet this one somehow compelled me to see my doctor, who then started the process that eventually detected the cancer on the other side of my body, completely unrelated to this lymph node in my left side. I'm here today because of good fortune. I was fortunate to have had a doctor who, though knowing my lymph node was normal, sent me in for that baseline mammogram anyway. I don't know why she sent me in for it 2 years early when she felt so confident about my lymph node, but I'm certain that it is a decision that likely saved my life. I'm here today because of luck. I'm lucky that the mammography picked up my spots in my breast because it is missed often and it was very early. I'm lucky that a radiologist opted to biopsy those spots for me. I'm lucky because I had only stage 1, but grade 3 cancer. And grade 3 cancer is the fastest growing and the most likely to spread cancer of all cancers. We all know that the earlier cancer is detected, the more likely the chances for that patient of survival are. For instance, a woman who's detected with breast cancer that's at stage 1 has an 85% chance of being alive after 10 years. If that cancer progresses to stage 3, that same woman only has a 40% chance of still being alive after 10 years. And if that cancer isn't detected until this woman is at stage 4, 10 years later, her chances of being alive are only 10%. It's easy to see that the key to surviving this disease is early detection. It's also reasonable to assume that depending on a fluke and good fortune and luck is not likely going to be the key to early detection for most women. This is the other reason I'm so excited about the fact that this new diagnostic tool may come to Pullman. If we have the means to detect cancer at an earlier stage, we must do it. I'm now the mother to 5 adopted children from around the world, and I am a mother to those children because of early detection. Most women will not have my good luck, however, and without this new technology, many of them will not have their cancer discovered until it is at a later stage and diminishing their chances for survival. So I'm asking you to support Pullman Regional Hospital in the acquisition of this new diagnostic tool that will diminish the number of false positives that women in our community experience and greatly increase, they'll greatly increase the chances of early detection for the women in our community and across Eastern Washington. Thank you for listening. Thank you. Thank you very much. As I shared, this disease affects everyone. In the audience are several of my sister survivors. I'd like to ask that they please come to the stage and join me in standing against breast cancer. If there are any other women in the audience who have survived the disease and would like to come forward, we invite you to do so. Survivors, please come to the stage. Thank you very much. I'm going to pass the microphone down and ask each of these women to introduce themselves and let you know how long they have been a survivor.
Oh no, here we are. It's just a blessing to be here, and it's a blessing to be alive, and it's a blessing to share life with every single one of you here. Looks like a bunch of sisters here that I'm just very grateful to be on the stage with. Thank you.
My name is Darsal Myers, and I have lived in Pullman for 22 years, which means I moved here when I was about 2. And so go ahead and do the math on that. Yeah, that's right. I'm a 4-year survivor.
My name is Karen Coonrad, and we have been in Pullman almost 47 years. I am a 14-year survivor, and I had my surgery at the old hospital, which, having a small hospital, was so wonderful. I rode the elevator with Dr. Wright, and he said, "What is your name?" And I told him, he says, "Well, I'm scrubbing for you." So I knew deep down I'd made the right decision to stay in Pullman, and I've never been sorry.
Thank you. I'm Penny Pearson, and I'm a 27-year survivor, and due to all the wonderful support from my family and friends.
I'm Peg Motley, and I'm a 6-year survivor. I'm one of the lucky ones, too, that caught it in time and didn't have to go through the chemo and radiation, which I'm extremely thankful for.
I'm Kelly Gertzen. I've been in Pullman almost 4 years, and I am a 3-year survivor.
My name is Karen Hess, and I have lived in Pullman for 8 years, and I've been cancer-free since June 17th, 2011.
I'm Marianne Workman, and I was diagnosed when I was 35 years old. I also had very young children and made the choice to have a mastectomy. That was 2009, and I don't regret it.
Thank you very much, ladies. Thank you for joining us on stage.